Good morning, everybody. Thank you so much for coming out this morning. Welcome to Sierra Sunrise. We're so glad you're all here today. My name is Katie Wilbur. I'm the Executive Director of RH Community Builders, and I want to thank you each for being here today to celebrate this great achievement. As I was considering my remarks for today, Facebook kindly reminded me that 5 years ago tomorrow, we had gathered for the ribbon cutting of our very first winter warming shelter that RH Community Builders operated. Of course, no one predicted that 75 days later COVID would happen, or that our 15 employees on that day would become 250 employees today, or that our one program would become more than 20 programs. But most importantly, perhaps, no one could predict that the once blighted Parkway Drive would become the epicenter of services and hope for so many Fresno residents who are experiencing homelessness. As our services have continued to expand in Fresno, there has remained a gap in services for the individuals who are not only experiencing homelessness, but concurrently experiencing severe mental illness, and in many instances, experiencing physical ailments too. When behavioral health bridge housing was announced last spring, we knew this would be the answer to so many of our needs. The state of California program has brought together many of the missing pieces, like we hope Sierra Sunrise will bring together the missing pieces for the individuals we serve. Sierra Sunrise brings together new and existing services, from the operational funds provided by behavioral health bridge housing to CalAIM Enhanced Care Management and Community Supports, and Medi-Cal mental health services in a way that shelter hasn't been delivered before. Demonstrating that when we have everyone from the Department of Behavioral Health to the homeless response system to the managed care plans, a magnificent program can come to life. The people we serve will be able to receive mental health services, housing navigation to access with the coordinated entry system, and case management to adjust their physical health, their criminal justice, or their workforce development needs, all without ever leaving Sierra Sunrise. With permanent housing solutions as the ultimate goal, Sierra Sunrise aims to remove the barriers of everything else that slows down a person's progress into housing. This comprehensive and innovative service would not be happening today without so many that are joining us. I want to acknowledge our leaders, Wayne Rutledge and Brad Hardy, who never hesitate to support the vision and jump into new projects, even when there are many more questions than answers. I want to thank the Fresno County Board of Supervisors and the Fresno County Department of Behavioral Health team, Director Susan Holt, Dr. Emma, Vincent, Christine, and so many more who believed in us and believed that Sierra Sunrise could come to life. Our managed care partners at Anthem and HealthNet, and our RH development team, Leslie Alvarado and Julian Estrada, who listened to me rattle off a bunch of ideas and make this once blighted motel into a top-notch, state-of-the-art place for healing. And of course, our RH operations team, our clinical director, Daisy Zamora, and our senior director, Abby Velasco, our program manager, Chad Fugati, and each of our staff here at Sierra Sunrise, who have really learned the true meaning of other assigned duties, because we all know that during startup, there are so many other duties to be done. Without each of you, Sierra Sunrise would not be here today. We look forward to a future where an additional 120 beds of behavioral health bridge housing will soon open at Phoenix Landing. We look forward to a future of seeing lives changed and potentials unlocked for each individual who enters the doors here. But most importantly, we look forward to a future where programs like this mean that not one of our neighbors has to experience another night of homelessness. It's my pleasure to now introduce the Fresno County Department of Behavioral Health Director, Susan Holt.
I failed. Ooh, hello, that's loud. I am Susan Holt, the Director of Behavioral Health, and I failed to let Katie know that I am not a solo act today. I would like to welcome up Dr. Emma Rasmussen, Deputy Director of the Department of Behavioral Health. She's going to join me today, and I really have to say that, I have a lot of really cool things that I get to do as the Department of Behavioral Health Director. This is where I get choked up. But by far, The best thing about my job is days like today when we get to celebrate the work of the staff of our department and our partners in the community who make things like this happen. Today's a great day, and it's a great honor to be here. So I'd like to build on the acknowledgments that Katie made and express appreciation to the state of California for really the vision to put the resources to the vision. California really is working to transform behavioral health services and address the social determinants of health. And we know that having housing inventory and supportive services to help people is one of those most important determinants. And so we're here today to really help execute the vision that the state has set forth. So we're really excited about that. The state works with partners to help counties facilitate this work, and I want to take a moment to acknowledge Advocates for Human Potential, AHP, our partners and consultants who've really helped us get to where we are today with the Behavioral Health Bridge Housing Program. I'd like to acknowledge today in our audience Michael Helmick, who is here from AHP. Thank you very much for the work that you've done to support our team getting here today. I'd like to also take a minute to give a little whoop whoop to Fresno County. I have permission to share from our colleagues at AHP that across the state, the County of Fresno is known as a front runner in addressing these behavioral health and housing challenges, and we should all be very proud about that here in the heart of the Central Valley, with one of the most critical workforce shortages in behavioral health and other industries, we get it done. And one of the ways we get it done is we have incredible support from our Board of Supervisors. Katie acknowledged our board, and I appreciate that. And I need to let you know sort of the behind-the-scenes support. I won't make eye contact with our board member because I don't want to put him on the spot. But our board always asks, what can we do to support the Department of Behavioral Health, the Department of Social Services, Public Works and Planning? They are 100% committed to supporting our community as we address the complex challenges that we face and to make sure that the people in our community get a roof over their head. Today is such a beautiful sunny day, and what a brilliant name for this property, right? The sun rose today, and we're seeing the sun shine. And at this property, people who were previously unhoused in our community, facing great health challenges and many other barriers to accessing the resources that will help them thrive, they're going to see the sun rise every day, whether it be literally like today or figuratively, as they begin to address those challenges and thrive. I want to take a moment as I start to wrap up to also talk a little bit about the CARE Act. Those of you who have heard of the CARE Act might know that California is really working to reduce barriers for some individuals in the community who have further barriers addressing care. And Fresno County will be launching our CARE Act program a little less than a year from now. So we look forward to more information coming to our community about that. But the reason that's important today is just to let you all know that in the Behavioral Health Bridge program, the CARE Act participants are prioritized. So we'll be looking forward to launching that program at the end of this calendar year. Without further ado, I'd like to talk a little bit about the passionate Deputy Director, Dr. Emma Rasmussen, whom I am embarrassing quite significantly because that's my superpower, apparently. This work takes passion, whether it be leading the county government, whether it be leading the housing and supportive services here at this new property, or whether it be leading the Department of Behavioral Health. Dr. Rasmussen has been with us for just about coming up on a year, and she is a brilliant leader, incredibly passionate, and she, like many of you, had a lot of opportunities. And she chose the county family for her next phase of her career, and I could not be more proud to work with someone who's got a deep, deep well of passion that drives the work. So I'd like to have Dr. Rasmussen talk a little bit about the team of behavioral health professionals who worked behind the scenes to make this happen today, and also appreciation to our public behavioral health team who helped us with this event.
Thank you, everybody, and thank you for being here. As already discussed, to be here today takes a lot of work. It's taken hours and weeks and months and years for us to be here today. And so just to join with what Susan and what has already been said, we couldn't have done this without a lot of community partnership in really sitting down at the table and discussing and planning and pivoting. And I wanted to acknowledge, to echo what has been said, but I want to introduce you to the heart of this project, the people who've kept the mission and vision at the forefront the entire time, and who have worked with so many of you to bring us here today. And so I'd like them to stand and join in embarrassing them, but to really acknowledge them. I think so much of what we see, we don't see what goes behind it. And so I would like Vincent, Megan, and Christine, and also so they are the ones that are the center that really have engaged just everybody else. I'd also like to acknowledge Jolie, who's with us today, who began this work with this team. And so again, thank you for the work that you do, and thank you for bringing us all together in partnership.
Thank you, Dr. Rasmussen. And now I'd like to turn the podium over to Supervisor Brian Pacheco to make additional remarks. Thank you.
Thank you, Director. I'm pleased to be here today, and it's not my intent to embarrass anyone today, so we don't have to worry about that. But again, Fresno County's Department of Behavioral Health has been engaged in 8 projects to serve the homeless population in our community. These have brought $47 million of state investment to Fresno County through our Behavioral Health Department for our homeless population. This funding pays for more than 400 housing units, operating with another 450 units in the works to be built through the behavioral health by the end of 2025. The most recent funding brought $21.8 million and will build 2 facilities. Sierra Sunrise, which we're here today, is focused on bridge housing, which is the transition, the bridge, to hopefully take clients from homelessness to permanent housing. This is the essential part of our program today. This program serves our homeless population and those with serious behavioral health issues with conditions for a place to call home. During their stay, as mentioned earlier, they have access to services for improving their lives, finding work, and of course, finding permanent housing. And in a few months, the county will open a second 100-unit bridge housing facility in a former hotel site near Blackstone and Ashland Avenues. We look forward to improving the lives of our most poverty-stricken residents and the needy residents with all the services that we can offer. As Susan said, it's our duty and it is our passion. And again, I'd like to compliment the Department of Behavioral Health for all that they do on that behalf. I want to recognize and commend Behavioral Health, RH Builders, as well as the state of California for all their work in making these projects a reality. Thank you. It's my pleasure. I'd like to introduce from our CAO's office, Amina Flores-Becker. Welcome.
Thank you all for being here today at this ribbon cutting. Unfortunately, our County Administrative Officer, Paul Nerlin, couldn't be here, but I am proud to be here on his behalf. As Supervisor Pacheco said, this is one of many housing projects that the county has undertaken, and this is one department that has undertaken a housing project. We have several departments at the County of Fresno who has undertaken a variety of housing projects throughout the county of Fresno. This project, the county's behavioral health bridge housing program, will add to the continuum of county resources available to support those with behavioral health needs who are also experiencing homelessness. Those who will reside here will receive necessary support and treatment services right here on site, which is a pivotal part of this program. Affordable housing along with supportive services remains a big need across the state of California and specifically here in the county of Fresno. I want to thank both the Board of Supervisors and CAO Paul Nerlin for prioritizing the needs of the most vulnerable residents of the county of Fresno who are experiencing homelessness here in our community by adding yet another resource, which is a program manager specifically dedicated to addressing homelessness in our office, in the CAO's office. Just a week ago, we posted a position for a homelessness program manager, and this is totally a selfish plug, by the way, because I'm wanting to get the word out there of this job opportunity. So for anyone interested, please go to FresnoCountyJobs.com. Fresno County and its departments will continue to work with numerous partners and agencies, communities across jurisdictions to help address the complex issues before us, as well as make significant investments in the wellness of our residents, and those investments include housing as a foundation of health and wellness. Thank you again, everyone, for being here. Yeah, that's it.
So we will now cut the official ribbon on Sierra Sunrise, and after we do that, we would invite you all to tour the facility. There are several rooms with blue balloons, which indicate they are available for touring. So please feel free to check those out, see what the services look like, and also have some refreshments, and we are very glad you're here. So now we will go ahead and cut the ribbon.